comes with the kidney. So if you go to the doctor, they will ask you this thing: is it acute? It's happened now, or it is a chronic one? Okay. Now today, inshallah, we'll discuss about the initial management of the poison patient and how we can manage the poison patient. So we have to follow some criteria. So let's start with this initial management of the poison patient with the A, B, C, and D. So A stands for the airways. Okay. Whenever the patient comes with the poisoning, these are our goals. So airway should be cleared of vomitus or any other obstruction, and an oral airway or endotracheal tube is inserted if needed. You have to make sure the person should breathe properly. Number one. Okay. So if there is any problem in the breathing or if there is any blockage, we have to insert this endotracheal tube so that it can remove the blockage. Number second, this breathing should be assessed by observation and oximetry, and if in doubt, we have to measure the arterial blood gas. Okay, so we have to measure, if you remember that during the cases of corona, if somebody has this difficulty in the breathing, we measure the oxygen saturation, right? So we have to measure this one, breathing, which should be assessed by the oximetry, and if it needed, we have to measure the arterial blood gases. Okay, then how much amount of the oxygen or how much amount of the CO2. Then number third, circulation. C stands for the circulation. Circulation should be assessed by continuous monitoring of the pulse rate, blood pressure, urinary output, and evaluation of the peripheral perfusion. So we have to make sure that the person may not go into the stage of hypertension. If it is hypertension, still we can manage, but hypertension is more risky than the hypertension. Okay. Then number D, disability. So we have to make sure the person should not be disabled because of that poison. So we have to give the dextrose, which is given intravenously to every patient with altered mental status, because we have some poison. If we delay that one, that poison make the patient unconscious. Okay, or patient may go into the coma. So we have to give the dextrose if you see any mental altered status of the patient. So this is about the A, B, C, and D. Then what is the goal? The treatment of acute poisoning must be quick. As we discussed in the pharmacokinetics and dynamics, that once the drug is absorbed, then it will give you the effect. So our main purpose is to prevent the absorption of the drug. Okay, or I say that prevention of the further absorption of the drug, because at that time when you bring the patient to the hospital, during that time some of the drug already absorbed. One of the very important questions the doctor asks from the patient, that how much time already been passed, or at what time he or she took that poisonous substance. Okay, so this we have to maintain some goals. Number one goal is maintain the vital function, any vital organs, for example heart, liver, kidneys, and brain. We have to maintain that vital function initially. Number second, that we have to keep the concentration of the poison in crucial tissues as low as possible by preventing the absorption or enhancing the elimination. And in both cases, when you prevent the absorption, the drug may not go into the crucial tissues. Or when you enhance the elimination, also the drug moves quickly and excreted out from the body. So this is the second goal. Then third, we have to combat the pharmacological and toxicological effects at the affected site. We have to see the difference between the pharmacological and the toxicology. If I give this drug, what will happen by giving this kind of the drug? So we have to be careful. Then there are some methods how we can prevent the further absorption. Okay, there are some methods. So number one of the method is the emesis. Emesis means induce the vomiting, which is also called as gastric decontamination. Okay, so we have to we can say gastric decontamination is to wash the stomach, or we have to induce the vomiting. So whatever the toxic substance that has not been absorbed, that will come out. Okay, so emesis, that is a gastric decontamination, but this process of emesis is not routinely used is contraindicated in certain conditions. And there are some poisons. In those toxicity of those poisons, we don't use this process of the emesis. What are those poisons? Number one is ingestion of the corrosive poison. What do you mean by corrosive? That makes you burn. Okay, corrosive means that makes you burn. B-U-R-N. So ingestion of the corrosive poison. Those who has taken the corrosive poison, for example, any acid. Okay, so in that case we don't use this emesis, because if somebody ingests a corrosive poison such as strong alkali or acid, and if the patient is in the stage of stupor or delirium, emesis causes the aspiration of the gastric content. Then we know that there are some gastric contents. If you induce the vomiting, that will also come out. For example, bicarbonate is very important for our body. So if you induce the vomiting, that bicarbonate or other effective substance will also come out. So in that case, in case of strong alkali or acid, we don't induce the vomiting. Okay. And also one more thing, that if somebody taking strong alkali or acid, now what will happen? That strong alkali or acid will burn your gastric lining. You got the point? And when you induce the vomiting, what will happen? That substance will again come and further burns your gastric lining. So in that case, we don't induce the emesis. Number one. Number second, if the patient ingests the central nervous system stimulant, any poison that may cause the hyperactivity of the central nervous system. And we know that in case of epilepsy or seizures, the patient may, the reason is because of the stimulation or hyperactivity of the central nervous system. So if any patient taken that substance which cause the stimulation of the central nervous system, we don't induce the vomiting, because further stimulation associated with the vomiting may precipitate the convulsion. Because again, as I told you, that substance will again come and that will also precipitate or increase the number of convulsions. Okay. Then these are the two methods.
First one, the ingestion of corrosive poison. Can you explain it more?
This one, that if somebody taking in strong alkali or acid, so we know that that substance will burn our gastric linings. It will damages the gastric system. So if you induce the vomiting, so what happens? In induce the vomiting, the substance will come again and further damages the gastric lining. So in that case, we don't induce the emesis. Okay? Because emesis is one of the methods. We have some other methods by which we can prevent the further absorption of the poison. Got my point? Okay? But there, as we discussed, that there are some conditions. In that conditions, this process is contraindicated, and these are the conditions. Okay? Then we have what are the other methods of prevention of the poison? Number one is the use of the ipecac. Ipecac, basically it's a syrup which is very, very, very bitter in taste. So when somebody take it, basically patient vomit out. Okay. So number second, we have a gastric lavage. Gastric lavage is simply lavage. We say that is a washing. Gastric lavage is simply the washing of the stomach. When we have seen the patient, what will happen? That they insert the tube from the mouth or the nose, and that tube goes here, and then in that tube we basically put the normal saline. Okay, because why we say normal saline? Because the same amount of the concentration of water is present in our body. If you see in our body, the concentration of the water is 0.9%, 0.9. So we say that is a normal saline. Okay, because normally it is present in our body. So we use that one in order to, because that will go into your stomach, and whatever the poison which is not absorbed still, so that poison substance with the help of the water will come out. You got the point? Okay. So that we say it is called as a gastric lavage, that is the washing of the stomach. The third one, we have a chemical adsorption. I told you about the difference between the absorption and adsorption before also. So when we say absorption, okay, so we say that, for example, if we say drug absorption, so that means the drug is completely absorbed. But when we use the word adsorption, we say just from the surface. Okay. So this chemical adsorption we can apply with the help of the activated charcoal. Now charcoal in Arabic you can call it as farm, the same farm which we use for the barbecue purpose. But that is not an activated form. So we need to activate that charcoal so it is ready for the use of medicinal purpose. Okay. In hospitals, if you see in every hospital, the Tiwari, the emergency department in the pharmacy, they have the containers of these activated charcoal. Why we say activated? Because it is now ready for the medicinal use. They have a container 50 gram, 100 gram, depending upon the patient. So we use that one with the help of that normal saline. So that charcoal when goes into the stomach, because we know that this charcoal has an adsorption phenomenon. So it will absorb the drug which is still in the stomach, okay? And with the help of the water it will come out. So we say this is called as a chemical adsorption with the help of the activated charcoal. Number 4, we can do the chemical inactivation. What I mean to say chemical inactivation, that we can give the antidote which can change the chemical structure of the poison. If you remember, we discussed about the antagonist in pharmacodynamics, and we discussed many types. So one of the type of the antagonist was the chemical antagonism. Okay, and I told you that, like for example, somebody have a toxicity with a mercury. So in that case, what we do, we have to give the antagonist that will change the chemical structure of the mercury. So we give dimercaprol. You remember it was mentioned in the slide. Dimercaprol is used as an antagonist for the treatment of mercury, arsenic and gold. So what will happen? That dimercaprol will change the structure and the properties of those compounds will also change. For example, I gave you the example of water. That H2O, water, has a neutral pH. But if you break down water, hydrogen and oxygen, now they have a different property. You got my point? So we give this one antidotes which can change the chemical structure of the poison, and then we can also apply this neutralization phenomenon. What I mean to say neutralization, that if somebody have a poisoning with the acidic drug, we can give the basic drug. Or if somebody have a poisoning with the basic drug, we can give the acidic drug. Another important point to remember here, that not all the drugs have antidote available. For example, we know for paracetamol, antidote is available. We know some other drugs, antidotes are available. But not all drugs, their antidotes are available. So if the antidote is available, we can give the antidote. But if the antidote of that drug is not available, then we have to treat the symptoms. And whatever the symptom appear, we have to treat those. For example, because of the poisoning, one may have a seizure. So you have to give now anti-seizure drug. Because of the poisoning, one may have an hypotension. So you have to treat the hypotension. You got my point? Okay. So these are some of the methods. And the last one, here we have a purgation. And what do you mean to say purgation? That we have to induce the, so that the patient can pass the stool, we have to give some drugs. So what will happen, that whatever the drug is still there, with the help of those boras or stool, it will go out. Okay. So purgation, that also is a cleaning. So these are some of the methods. We have use of EPK, gastric lavage, chemical adsorption, chemical inactivation by 2 methods, either by antidote or neutralization, and the final one is the purgation. Yes, please.
And the gastric lavage be done through pills from the pharmacy?
No, gastric lavage basically it's insert, because we have to introduce the water in that. Because if you give the pill will take some time for their absorption. So pill basically is an antidote. You got the point? Yeah. And we tried our best to give the intravenous treatment. We don't wait for the oral. Because as I told you, you don't have enough time. So let some drugs there absorb in 30 minutes. So if patient already came hospital and during that traveling it takes some time, so you don't have enough time. So our main purpose is to prevent the further absorption of the drug. You got my point? Okay. What will happen? If we prevent the further absorption, the chances of toxicity will decrease. Okay.
So purgation is basically using laxative.
Laxative, yeah. Okay. Yes, please.
Can you repeat APKA? The first one I didn't
APK
understand.
basically, you missed that.
I didn't understand it.
Okay. So, but you were present here, huh? You were
Yeah.
here. Okay. APK basically is the syrup, is the sharab that has very bad taste, bitter taste. So when you take that one, what will happen? That may induce the vomiting. Okay.
Okay, but it shouldn't be with emesis in the previous ones.
So we discussed that emesis is there. So there are many methods of emesis. Sometimes you just, if you put your finger here,
Yeah.
then you can induce the emesis. But sometimes we need to give that syrup. Okay.
Okay,
So we don't wait for the absorption, because if you feel very bad taste, you automatically vomit.
Right, so, okay, but we make it as a, a separate way. We don't,
Yeah, these are the different methods, all.
yeah,
Okay, so sometimes we have to do more than one method. But as I told you, epic we cannot use in some conditions we discussed in the previous slide.
Yeah.
Okay, we can do more than one method. You can also do gastric lavage. We can also give antidote at the same time. You got me right? Sometimes, as I told you, we don't know what is the active substance in that toxic or in that poison. For example, you are the doctor, the patient comes to you and they say that stop playing with the mobile, put your mobile down. Okay? If the patient says that my son or my daughter, she took any substance, but they don't know. So at that time, you cannot give the antidote, because for antidote you should know the poison. So what do? At that time, you basically give these activated or gastric lavage or activated charcoal, because that charcoal will take the drugs out. You got my point? Okay? So these are the methods. Then there are some other methods which can enhance the elimination of the poison. So one method is the biotransformation. We discussed last time also that if you metabolize the drug rapidly, what will happen? The drug moves quickly and go out from your body. Number second, biliary excretion. You have to increase the excretion of the drug, either biliary through bile or either through urinary excretion. Okay. Then number third is the dialysis. I think we discussed in medical terminology also. Dia means complete and lysis means separation or breakdown. So dialysis is one of the techniques in which we can remove the toxins from the blood. Okay. So this is actually very common in those patients whose kidneys are not functioning properly. Okay. Because those patients who have a renal failure, kidney failure, and that kidney failure, if it is chronic, but we discussed chronic, it's very difficult to treat. The only treatment in that condition is to dialyze the patient, okay, every alternate day or sometimes after 2 days, because whatever the food you eat, in that we have a toxic substance produced, so that's why we have to dialyze every 2 days. So it's one of the procedure in which the patient is connected to the machine with the help of the tube. That machine has a filter. So that machine will clean the blood, and then that blood will go back to the patient. But remember, if you compare the dialysis with the natural function of the kidney, you cannot compare. Because after every dialysis, the patient may have only 5% of renal function, 5%. During that 5%, they can live for 2 days, okay, or 3 days, and then they have to come again for the dialysis. You got my point? Okay, one way. Second way, those whose kidneys are not functioning properly, some patients, they cannot pass the urine also. So they have this fluid accumulation. So if there is a fluid accumulation, there is a shortness of the breath. So this is basically the dialysis in which we remove the toxins from the blood. So in those patients who have this toxicity of any compound, in some cases we need to go for this option, that is a dialysis. Got the point? Okay. So this is dialysis. And number 4 or number last one is the antagonism. Antagonism, that is we discussed by giving the antidotes or by following the neutralization phenomenon. For example, salicylate. Salicylate basically we discussed last time about aspirin in the phase 2 metabolism. So aspirin, the chemical name of the aspirin is acetyl salicylic acid. So it's basically salicylate is an acid. Okay. So if somebody has a poisoning with the salicylate, so what we do the urinary alkalinization with the help of the intravenous sodium bicarbonate. And you have to make the urine alkaline. So that alkaline urine will take the acidic drug out. Okay. So intravenous sodium bicarbonate is alkaline or basic in nature, so we can get that one. Or if somebody have a poisoning with the basic substance such as an amphetamine, so we can enhance the acidification of the urine, and if you have to make the urine acidic by giving the ammonium chloride or ascorbic acid, so that acidic urine will take the basic drug out from the body. Okay? So these are some of the methods by which we can treat the patient. Yes, please.
Isn't that basically neutralization?
Which one?
Those two examples you just gave us.
Yeah, utilization. Yes, it's a utilization.
So
Okay?
it's basically repeating what we said.
Yeah, because we discussed that sometimes antagonism or antidotes are not available. Okay, so these are. Then we discussed this point in the last slide. For clinical purposes, all toxic agents can be divided into two classes: those who have an antidote or those who don't have an antidote. So I told you, if the antidote is not available, or if you don't know what type of substance produces the toxicity, so what we do, we can go for the symptomatic treatment. Okay? So these are the some commonly used antidote. We have a big list, but these are some commonly antidote, and you have to remember that one. So we have an acetaminophen, which is also called as paracetamol. What is the antidote? We have an N-acetylcysteine. Then we have an anticholinesterase, organophosphates, and carbamates. These insecticide killers, majority of the time, most of the time, they have an organophosphates as a main ingredient. So we give the atropine. Okay, atropine basically it's an anti-muscarinic drug. What is muscarinic? We'll discuss later on. These are the receptors which is present in our body. So they block those receptors. So we'll discuss in autonomic nervous system. Then we have a calcium channel blocker. Somebody take these calcium channel blocker. Those will block the calcium channel, because this calcium channel, they are very important for the function of the heart. Okay? So we have to give the calcium. Then those who take the methanol or ethylene glycol, is correct the spelling? So this is METH. So just put H after D. So if somebody takes methanol or ethylene glycol, the antidote is the ethanol. If somebody takes benzodiazepines, okay, benzodiazepine is one of the drugs which we can use in seizures also, okay, or in epilepsy. So the antidote here we have it available, flumazenil. Then the narcotic drugs and other opioid derivative, narcotic, that is a morphine or these kind of the drugs. So our antidote is the naloxone. Okay. Then finally, if somebody have a poisoning with the carbon monoxide, the antidote is the oxygen. You got the point? So these are some of the list of the antidotes which we have to give for the treatment of the poison. Is it clear? Yes, please.
In slide 16 here, it said initial management of the poison patient ABCD. What does this mean exactly?
This means that when the patient comes, you have to immediately check the airways. You see, when, in case of the toxicity, when the patient comes, multiple nurses involved. So one is checking the breathing, other is checking the blood pressure, because these are the important parameters. You got the point? And we have to check the status of the patient. It's very, very important. The patient is stable or not. If it is not stable, if you see that patient is not in the proper mental state, so there is a risk now that patient may go into the stage of coma. So we have to give the dextrose, which is D, sugar. You got the point?
So
these
like groups or something?
ABCD, basically we say that A means airways. So we should know our airways clear, should clearly breathing properly. Then B is breathing. So we have to check the breathing. How we can check the breathing? By checking the saturation of oxygen, and sometimes we have to measure the blood gases. How much amount of the oxygen or CO2 present in the blood. The third one is circulation, because we are making sure that the blood circulation will not be stopped. Because if there is any blood circulation stopped, then the patient may go again into the stage of coma or other things. You got it, right? It's a general assessment. It's not a category of the problem. Okay, we mentioned ABCD, so you can remember. Okay, so A means airways, B means breathing, C means circulation, and D means the disability. You got the point?